नमस्कार साथियों, मैं डॉक्टर लोकेश भाटिया स्वागत करता हूं आपका लोक टॉक्स चैनल पर। डियर फ्रेंड्स, आई वेलकम टू यू ऑल इन दिस वीडियो टुडे on लोक टॉक्स. Today we'll be talking to you on one of the most wanted topic, and that is what are the common causes of low back pain. Low back pain, as we all must have suffered some or other time. I'm sure each and every viewer watching and listening to this video must have come across the experience of his own or some other family member with low back pain. Just small bending down and one gets a catch at the back. Sports injuries and many other reasons. So we will talk about this topic today in this video. Welcome to you all.
Namaskar. Welcome to Lok Talks. Thank you very much for subscribing to this channel for professional medical guidance, spirituality and meditation and life coaching. Here is my WhatsApp number. Do connect me in person if you have any question. Thank you.
What can cause low back pain? Let's understand this. Most acute low back pain is a mechanical in nature, meaning that there is a disruption in the way the components of the back, that is the spine, this one, the spine, the muscles surrounding the spine, the intervertebral disc and nerves fit together and move. Some examples of mechanical low back pain. Mechanical causes of low back pain include, number one, it can be congenital, that you are born with some such fusion or those kind of problems, fusion amongst the two vertebrae, or skeletal irregularities such as scoliosis, that means a curvature of the spine, right? Then lordosis, an abnormally exaggerated arch in the lower back, or kyphosis, that is excessive outward arch of the spine, and other congenital anomalies of the spine. These can be the common causes. Then comes the spina bifida, which involves the incomplete development of the spinal cord. Well, as we all know, in the spinal column, we have a spinal cord and the protective covering surrounding the cord. If there is any problem happening with that, can result in this kind of low back pain. Low back pain means whenever we say, a common man says low back pain, that means it is interpreted as the pain in the lumbar region, L1 to L5, or lumbosacral region, up to here, to your tailbone region. So that is the region and the causes of which we are discussing in this video. Spina bifida, which involves the incomplete development of spinal cord and or its protective coverings, and can cause the problems involving the malformations of the vertebrae and abnormal sensations, and even paralysis can also happen. Next cause comes as injuries. It can be because of sports injuries, it can be because of just bending down and muscles and getting tear. Then sprains, the overstretched or torn ligaments, strains, that is tears in the tendons and the muscles, and spasms, that is sudden contraction of a muscle or a group of muscles, right? So these are the possible causes, may apply singly or may apply multiple causes in a patient. Traumatic injuries such as from playing sports, car accidents or fall, that can injure the tendons, ligaments, muscles, causing pain as well as compress the spinal cord, spinal column, or can cause the disc to rupture or herniate. Then comes next. The number is degenerative problems. There can be degenerative intervertebral disc degeneration, which occurs when the usually rubbery disc or watery disc is present, and these discs will wear down as a normal process of the aging and lose their cushioning ability, which is supposed to be present in young age. Then comes spondylosis, the general degeneration of the spine associated with the normal wear and tear of the structure surrounding the spinal column. Right? The structure surrounding the disc is annulus fibrosis. Any tear in that can cause pain. Then the bones of the spine, as people get older, they become degenerated. The facetal joints can also be a cause of pain. Then next comes is arthritis, or the inflammatory diseases in the spine, including osteoarthritis and rheumatoid arthritis, as well as spondylitis, as the inflammation of the vertebrae or the discitis can also cause the pain. Then comes the nerve and the spinal cord problems. So all these structures can get involved, and that is why one needs to see an orthopedic surgeon or a spinal surgeon at least. Then comes the spinal nerve compression, inflammation and or injury to the spinal structures or nerve roots going down in the lower limbs, that is sciatica, also called radiculopathy, caused by something pressing on the sciatic nerve. Most probably it is the disc, the gelatinous disc, which moves out of its place and causing the pain in the buttocks or extends down back of the leg. Right? People with sciatica may feel shock-like or electric current-like pain in their back, or the pain going down up to the radiating down in the lower limbs or in the calf also. Calf up to the tendo Achilles or just up to the heel even, in one or both the legs. Next pathology comes is spinal stenosis. The narrowing of the spinal cord, the structure in which the spinal cord is passing, all that it can cause a lot of structures can become hypertrophied, or the ligamentum phlegm can also become hypertrophied and can result in spinal canal stenosis. Spondylolisthesis, which happens when one vertebra which is slipping over the lower vertebra. The upper vertebra is slipping over the lower vertebra. The upper vertebra then slips back, it's called retrolisthesis. When it goes forwards, it's called spondylolisthesis. Right? And herniated disc and spondylolisthesis can both be existing in together. So, to rule out spondylolisthesis, we definitely need to get an X-ray done in every case of low back pain. Right? Then comes infections involving the vertebrae, a condition called osteomyelitis. The intervertebral disc can also become infected, can result in discitis. Or the sacroiliac joint. The sacroiliac joint is present here. This is sacrum bone and this is the iliac bone, and the sacroiliac joint can also become inflamed and can give rise to pain, and this is called sacroiliitis. Then next comes is cauda equina syndrome. Occurs when a ruptured disc pushes into the spinal canal and presses onto the bundle of the lumbar and sacral nerve roots. Permanent neurological damage may result if this syndrome is left untreated. I have covered quite a bit in my previous video on lumbar disc, video which I had made, something published 10 days back, that has covered very well. So we will skip little, will not go into much details of it. Then comes osteoporosis, a progressive decrease in the bone density and the strength that can lead to painful fractures of the vertebrae. Then there can be non-spinal sources which can give rise to pain in the low back region. Number one is kidney problems. Can cause sharp pain in their lower back, which can radiate forwards in the groin. That is, we call it loin to groin pain. Then can be endometriosis or buildup of the uterine tissues in places outside the uterus. Next comes is fibromyalgia, a chronic pain syndrome involving widespread muscle pain and fatigue with disturbed sleep, right? That is fibromyalgia. Then comes tumors that press on or destroy the bone in the spine or the spinal cord or the nerves or outside the spine, elsewhere in the back. Next comes is pregnancy. Back symptoms almost always completely go away after the delivery. So those pregnant ladies who are getting their back pain need not to worry about it. They have to go through that period and need not to worry about the back pain problem, as the delivery will take place very soon. It will be all right. Okay. So these are all the possible probable causes and with their probable diagnosis. We all need to know about it, which may singly apply in a patient or multiple factors may be operative in a particular patient. Right? So I hope you enjoyed listening to and understanding this particular video. What are the possible causes, what are the possible structures which can be involved, and what are their possible probable diagnoses. Right? Thank you very much. Hope you like the content, and make sure that you are sharing with all your friends and relatives who have back problems. They may get some good help. If you have any question, my WhatsApp number is here. You can always connect me for any consultations purpose, definitely online consultation. If you have all the detailed workup done, I'm always here to help you out, make you understand. If something which you are finding it difficult to understand, I can definitely make you to understand. Feel free to connect and contact. Thank you very much. All the best. Bye-bye. God bless you.